What if the reason you feel tired, foggy, or off isn't just stress, diet, or age, but something happening quietly inside your gut, without obvious warning, and because it builds gradually, it's often misinterpreted as something else. Stress, fatigue, just a long day. As a clinical pharmacist in my practice, I notice fatigue, digestive discomfort, and low resilience are common concerns men bring up, often without a clear explanation. And very often, underlying inflammation is part of that picture. When men think about inflammation, they often think about pain, swelling, or injury. But the type of inflammation that affects gut health is different. It's lower in intensity, but longer in duration. And because it doesn't create immediate discomfort, it often goes unnoticed. It doesn't demand attention. It doesn't force change, but it quietly influences how the body operates day after day. Deep within us, the gut plays a profoundly central role, acting as the primary regulator of the body's entire internal environment. It's a complex and intelligent system, far more than just a simple tube for processing food. Its most well-known function is, of course, digestion, breaking down the food we eat to extract vital nutrients. But it simultaneously performs another critical job. It serves as a powerful, protective barrier. Think of it as a highly selective filter, a sophisticated gatekeeper that meticulously determines what gets absorbed into the bloodstream and what must be safely contained and expelled. This barrier is our first line of defense against the outside world. When this intestinal barrier is stable and intact, the entire system functions with remarkable efficiency, promoting overall health and well-being. But when the delicate balance of the gut environment becomes disrupted, this crucial barrier can lose its integrity and become less precise. The tight junctions between cells may loosen, creating what is often called leaky gut. This change is subtle at first. It doesn't immediately disrupt digestion in a noticeable way. However, it fundamentally begins to alter how the body filters what it's exposed to, allowing substances that should be blocked to pass through. This breach triggers an immune response, and that's where chronic, low-grade inflammation begins. As the gut barrier becomes less regulated, substances that are normally contained can begin to pass through. The immune system recognizes these as potential threats and responds. This response creates inflammation, and this response is designed to protect the body. But when it repeats without resolution, it begins to shift the baseline of the system, not as a single event, but as a repeated signal. Over time, that signal becomes persistent. When inflammation becomes sustained, it begins to affect how systems communicate. Energy becomes less stable. Recovery slows. Hormonal signaling becomes less efficient. Cognitive clarity becomes harder to maintain. These changes are not random. They reflect the internal environment the body is operating in. These effects don't happen all at once. They accumulate, gradually changing how the body responds to everyday demands. For many men, the realization doesn't come from a single dramatic symptom. Instead, what they often notice is a subtle but persistent pattern emerging in their daily lives. It's a collection of small signals that, when viewed together, paint a larger picture of a body that's out of balance. It starts with a feeling of low energy that doesn't fully recover, even after a full night's sleep. The usual morning vitality is replaced by a lingering fatigue that shadows the entire day. Then there's the digestive discomfort that comes and goes without a clear cause. It's an unpredictable annoyance that makes it hard to enjoy meals or feel truly settled. You might also feel a reduced resilience to stress. The small pressures of work and life that you once handled with ease now feel overwhelming, leaving you tense and drained. Even physical recovery seems slower. Workouts that used to energize you now require more effort and longer rest periods, with muscle soreness lingering longer than it should. Individually, these changes are subtle enough to be dismissed, but they are consistent, and over time, this new, diminished state begins to feel normal. What makes this so difficult to address is the lack of a clear starting point. There's no single moment where everything changes, just a gradual, almost invisible shift in how you feel day in and day out. The important point is this: inflammation is not fixed, it is responsive. When the gut environment stabilizes, inflammatory signals can decrease. As the environment improves, the system begins to recalibrate, slowly returning to a more stable state. The barrier can regain function, systems can begin to rebalance, but this process depends on the conditions the body is given. From a clinical perspective, inflammation is not just a symptom. It's a powerful, crucial signal. It's the body's fundamental way of communicating that something is out of balance. Think of it as an internal alarm system, a direct reflection of how the entire system is responding to its environment, both internal and external. Too often, the conventional approach is to simply silence that alarm. But sustainable, long-term improvement doesn't come from suppressing the signal. That only masks the underlying issue, allowing it to persist or even worsen over time. True progress comes from listening intently and understanding what's driving it. We must ask, the alarm is sounding in the first place. And in many cases, the investigation leads us directly to the gut, which is at the very center of that process. The body responds to the environment it's in, and the gut is the primary interface with that environment. And this is where a shift in perspective matters profoundly. It's about moving beyond a reactive approach. It's not just about identifying the symptom, but understanding the intricate pattern behind it, tracing the issue back to its source for a more foundational and effective resolution. This was episode 8 of the ManBiome series. In the next episode, we'll bring these concepts together and break down how gut health connects directly to energy and performance in men. Subscribe and turn on notifications so you don't miss the next episode. Continue to episode 9, the gut energy connection in men. Rebuild from the gut up. The information shared in this video is for educational purposes only. Always consult your healthcare provider regarding your individual needs.